Good afternoon. My name is Mariana Roriz. I am an undergraduate dental student at the University of Brasília. My research is supervised by Professor Fabrícia, and the topic of my study is analysis of the salivary pH and buffering capacity in patients with dentin hypersensitivity, a cross-sectional clinical study. Dentin hypersensitivity is a multifactorial condition frequently encountered in clinical practice, and it's characterized by a short, sharp pain arising from exposed dentin in response to various stimuli, which cannot be attributed to any other dental defect or pathology. The prevalence of DH in adults ranges from 11% to 33%, with a peak incidence between 30 and 40 years of age. Also, the DH is often associated with a negative impact on quality of life due to discomfort during eating, drinking, speaking, and toothbrushing, which may compromise the oral health. Several studies indicate that DH has multiple causes. However, it's closely linked to non-carious lesions that are defined as the loss of tooth structure not caused by microorganisms. Grippo proposed a phytodynamic model of tooth wear based on a triad of stress, friction, and biocorrosion. Those factors are currently believed to act synergistically. The combined can lead to DH, a common symptom associated with tooth wear. Among these, biocorrosion, defined as the degradation of dental structure due to intrinsic or extrinsic acids, has been identified as a key mechanism contributing to structural weakening. In this context, saliva plays a crucial protective role against acid exposure, especially through its buffering capacity, which is largely attributed to the presence of compounds such as sodium bicarbonate. These compounds help maintain physiological pH levels in the oral cavity. However, disturbance in the salivary balance may impair this protective mechanism, allowing acid-induced erosion and contributing to the onset or exacerbation of the dentin hypersensitivity. Given this background, the aim of the present study was to analyze salivary buffering capacity and pH in patients with DH in order to characterize the salivary profile of these individuals and support appropriate clinical management. A total of 39 participants were selected from the University Hospital of Brasília project, focused on diabetic patients and individuals using analgesic medications that could mask hypersensitivity symptoms, as well as those with active carious lesions, were excluded from the study. Data were collected using a lifestyle, dietary, and oral hygiene questionnaire based on a clinical chart adapted in partnership with the Federal University of Uberlândia. The presence of DH was assessed through clinical examination, where pain was elicited by an airjet applied to all teeth and scored on a numeric scale from 0 to 10, using the visual analog scale. The cyanometry was conducted by collecting stimulated saliva over a 5-minute period using a stellar plastic container, as you can see on this image, and the samples were then analyzed in the laboratory to determine salivary pH and buffering capacity using a digital pH meter. The variables analyzed include age, pain intensity, buffering capacity, which the values that are below pH 4 were considered indicative of low capacity, and salivary pH classified as acidic, ideal, or basic. The mean age of participants was 52 years old, and of the 39 participants, 33 were presented with BH. Among them, 41% reported severe pain and 33% moderate pain. Well, the descriptive analysis revealed that patients with the age had a mean salivary pH of 7 and a mean buffering capacity of 3.15. In contrast, the group control had a mean pH of 7.4 and a buffering capacity of 3.86. Participants reporting severe pain show a reduced buffering capacity of 3.13 compared to the group control and those with lower pain levels. And these findings indicate that both groups, the control and the patients with the age, exhibited reduced salivary buffering capacity, suggesting a general inefficacy in the salivary function. However, lower values were notably found in patients with the age and severe pain, indicating that additional salivary factors may be involved in the etiology of dentin hypersensitivity. Therefore, the relationship between saliva and the age should be further explored in future studies.